I love what I do. You know, it doesn't seem like work to me. People always ask me like, oh, isn't it sad working in oncology? I'm like, no, yes, there are sad days, but not really, because you get to help people nourish themselves during, you know, such a challenging time. When you're diagnosed with cancer, there's so many unknowns and so many things are out of your control. So people want something to hold on to, something to ground them. And diet is that, nutrition is that.
My name is Renee Stubbins. I'm a clinical oncology dietitian educator, and I have been at Houston Methodist since 2012, so about 12 years now. An oncology dietitian is a dietitian that's specialized in oncology nutrition specifically. So we focus a lot on screening and preventing and treating malnutrition. Unlike other dietitians, when their usual focus is weight management, our focus is usually on weight maintenance or even weight gain. We help patients and caregivers manage the nutrition impact factors that happen during treatments. So from chemotherapy, radiation, they're dealing with nausea, or if they're dealing with taste changes or mouth sores or difficulty swallowing, it's our job to find interventions to help treat those.
Miss Catherine Gonzalez, so she's one of my rock star patients, honestly. So she's been on, you know, chemo for a while, and pancreatic cancer is usually a very scary diagnosis with anyone, and but cancer is like any other chronic disease. So it's just like diabetes, it's just like kidney disease, you know, it's all about controlling the cancer. So in her situation, you know, the doctor's been able to control the cancer. She's really done great. She's really pro-nutrition, always been very in tune with her body. Good morning. How are you, Miss Gonzalez?
I'm great. No, I mean, I really have nothing to complain about. I feel great. I have energy. I can
Activity levels
enjoy,
still okay?
Yeah, Pilates and walking and, you know,
That's
going to my
awesome.
meetings and Bible studies and just babysitting the grandbabies and just really, everything's good.
Yeah, that counts as
Gaining weight too. I don't know if that's good, but
that is good. I was just saying, noticing
Yeah.
that your weight was trending up. I mean, I'm happy about that.
Yeah, I was
how you
kind of
feel.
scrawny, you know, but I kind of liked it in a way. My pants are getting a little tight. I probably ought to start.
I think this is a
to
good
cut
weight
back.
on you. Yeah, but the activity level, like being active, that's really important, because remember, your red blood cells, your white blood cells, your platelets all live in your bones. So when you're moving around, you're stimulating that production, so to help recover and rebuild. So those kind of weight-bearing activities, anytime we're standing up, gravity's pushing down on our bones and helping that. So that helps, and then just making sure you're getting your protein, but you're doing your daily protein shake a day. So
Yeah, and you know, I have to watch the carbs, so I know that if I do carbs and protein together, I tolerate it better.
yes.
Yeah, so I try.
You're so good.
Well, I've had 2 years, you know.
You're so good. You're paired it so well.
should have known.
That food pairing makes a big difference,
It
the
does.
protein and the carbs.
Yeah,
So,
it does.
good job.
Yeah, okay.
All right. Well,
Thank
I will
you.
see you next time, okay?
All righty.
Let me know if you need anything.
I will.
All right. Bye-bye. So this is the Horizon Hope Garden. Ashley and I started this, or helped installed it in 2018 as part of a clinical trial. It was a collaborative effort. We did get a small grant from the Center of Health and Nature. We had some very generous donors from the community that donated their time and their efforts. We really wanted to give patients something pretty to look at while they were here getting their infusion appointment. There's actually a lot of clinical data, whether it's elderly, chronically ill patients, acutely ill patients, with nature. So we really wanted to try to bring nature to our patients and have them connect with it. Our goal is to expand the garden to one day be able to have them safely come outside and be able to spend time out here. Chemo infusions can last anywhere from 3 hours to sometimes 8 hours. So being able to take a break while they're waiting for the labs to come back, have a nice sitting area. So yeah, that's our garden. It's a labor of love. You know, it's very therapeutic to come out here. We've had a couple of volunteers. Again, we've had a lot of, you know, generosity from the community. We still do, and we continue to kind of seek opportunities to try to expand it, do different things with it, and do different projects with our patients with it as well. I lost some very close family members. I lost my father to cancer when I was very young. He was diagnosed when my mom was 6 months pregnant with me. And this was in the 80s, so not as much advanced treatment back in that day. But he was way ahead of his time. He actually had his nutrition almanac, and he was very nutrition oriented. He was very much into physical activity and exercise, had his own gym, and he actually prolonged his life till 4 years. So, you know, that really inspired me in my original, you know, I guess, quest to really figure out, how does cancer feed itself, you know? And I thought, like, okay, if you could just figure out how to feed a person, not cancer, then we can starve out cancer. So that was my graduate work. I really wanted to understand the biochemistry, the metabolism behind cancer and what feeds that cancer cell, and understand all of the pathways. My desk is definitely my personal space. You know, oncology is heavy. There's definitely some really sad days. You know, it definitely can get to you. There's more happy stories than sad stories, but, you know, I've had patients I've taken care of for years, so you naturally develop relationships with those patients. Some of the things on my desk are paintings that I had a patient paint for me. You know, things that you just can bring back the happiness if you're having a tough day. I love unicorns, I love sloths, I love all magical creatures. The plants, I actually have a plant that was given to me from a very dear patient. I'm still taking care of her to this day. Those are my orchid plants, so they are resilient, so they've been through a lot, so I guess it's appropriate that they're there.
So Mr. Zamora, he's getting his last chemo today, so he's gone through his 7 weeks of treatment. He's done great. He's had, you know, a hard journey, but unfortunately a very typical journey for most of my head and neck patients. So he's a 69-year-old male, so he's looks like in great shape, you know, so I was really kind of surprised on his age when I saw him in person, because he had a very robust lifestyle. He, you know, would go out, you know, most nights, and then he would also run around Memorial Park.
How are you feeling?
I feel great. I feel good. I feel very relieved because it's week 7. This is my 7th week, and feeling pretty good, actually.
How's everything going with your feeding tube?
Feeding tubes, doing fine.
Okay. How many cartons?
It's 4.
Okay.
4, and 4 waters.
All right.
It's hard. It's tough.
Okay.
I mean, it's not easy, but it's keeping me alive. It's keeping me going. It's amazing. I miss my taste buds.
Yeah.
I mean, what can I say?
Yeah.
I know no sores in my mouth, which I was told I would have them, and nothing, which is great. Still have my hair. Thought I'd lose it. Not
Hair looks
much,
great.
but
Hair looks great.
I mean, I just, I feel good. I feel great. It's been what seems like a long journey. It really has, but if it weren't for you people, it would make it so much harder.
Yeah. Well, you've done great.
Thank you.
You really have.
Let me tell you, it's been a struggle. It's been a fight, but knowing that I'm in Methodist hands, I'm good.
Yeah.
Yes. How are you, Renee?
I'm good. You're doing great as always. If I had a gold star, I would give you a gold star sticker. I actually do need to start carrying stickers. I feel like sometimes I need to actually give someone a sticker. Yeah. Well, I missed.
We love you, Renee.
I love you too.
Okay.
All right. Let me know if you need anything, okay? All right.
I never really wanted to talk to people that much. When I was originally a dietitian, I liked to be in the ICU, and that way I could just do what I wanted to do and get done. But all I do today is talk to people, and I love it. It's very satisfying, because when I do get that dietitian win, and I do see my patients thrive, and I see that they're doing better, and I know it's something that I did, that we did together, it's such a great feeling. It's such an elation. It's such a win for all of us.